This segment is sponsored by Agentis Longevity. The science of longevity is advancing faster than the infrastructure to deliver it. At Agentis Longevity, they're building the national platform to change that, connecting physician-led clinics with the diagnostics, therapeutics, and operational support. And joining us now to tell us more is the CEO of Agentis Longevity, Jimmy St. Louis. Welcome to Great Day, Washington. Thanks for being here.
Wonderful. Thanks for having me.
Of course. Jimmy, I know you're working to build what you call the standard of care for longevity medicine. What inspired you to build this company, and what's the mission driving Agentis?
Sure. I believe that one of the most important things we can do in America is to give people access to proactive preventative care. There's a chronic disease epidemic that is continuing to sweep the nation. And from our perspective, getting out in front of your healthcare issues is the single most important thing. As a former athlete who's always focused on health optimization, plus a current healthcare entrepreneur, to me, this marriage of those two different worlds was a perfect combination for us to embark on this journey of creating this best-in-class solution where we're building trust with healthcare consumers and truly helping them to get out in front of their health issues really before the health issues would begin for them, giving them access to trusted providers, helping them understand what innovative healthcare can do for their own health to ultimately help them prevent these diseases. That was the inspiration behind launching Agentis Longevity.
Yeah, empowering people to get in front of their own healthcare. That sounds great. And I know you're in Washington leading a national roundtable on veteran care. Jimmy, what are the biggest challenges facing our veterans today, and what do you hope comes out of this discussion?
Veterans need access to this type of care as well. And I do believe that there's portions of our healthcare system that could not just be improved, but they could adopt new, more innovative healthcare solutions and technologies. We're primarily with the VA focused on helping to bring in advancements in hormone optimization therapy into the veterans, the VA, which gives us the opportunity to not just give them a chance to help them get their hormones in line, but there's also direct correlation to symptoms like PTSD. We do realize that there is an epidemic of suicide, which is tragic in our country here for our veterans. And there's a direct correlation of this science to help to prevent and or mediate some of those challenges. So we are hosting this roundtable here in DC. The objective is to work with members of Congress to really be able to push bills forward, as well as to get the support of the VA to adopt these types of solutions and ultimately give our veterans access to advancements in this type of care.
Yeah. And why does personalized, innovative healthcare belong at the center of the national conversation on veteran and active duty care, not on the margins?
I think the most important thing when you think about health is how do you take your health into your own hands? From our perspective, physician and patient autonomy should be paramount. Patients should have opportunities to have access to advancements in care. They should be able to take their own health into their own hands. There should be physicians that have access to innovative care, and that collaborative environment for patients and physicians to work together to just take their health into their own hands is paramount. So when you think about access to great care at the VA, this collaboration that we're doing with them is so exciting because for the first time, there are new advancements in care being introduced to the VA where patients and our veterans are demanding this type of care. And from our perspective, that level of personalized care is certainly paramount. Give them access to innovation around blood work, to their what we call the longevity quotient, which is our way of helping to do a comprehensive assessment. Give them access to that type of information to be the first of its kind, and for the first time, is something that we're really excited about.
You mentioned the longevity quotient to score biological age across 8 biomarker domains. Jimmy, how do advances like that in preventative medicine, diagnostics, and personalized care change health outcomes for veterans and ultimately for every American?
So we've developed this program called the Longevity Quotient, really centered around making sure that advancements in healthcare can be accessible and affordable. We've created this solution that is a 15-minute onboarding assessment that does a comprehensive assessment of your cognitive health, your certain biomarkers, so your hormone domains, your heart health, your body composition. We're giving people a comprehensive 360-degree look at their health, and we're leveraging all those markers to give them care plans within those particular domains. So the longevity quotient wasn't just launched to have this a new innovation in the healthcare field, but it was launched to help create this logic around these care plans for patients to be able to understand, wow, my cognition could really be in better order, my hormones could really be in better order. So this 15-minute onboarding assessment is helping to inform that care plan. And with our work directly with the VA, the ambition is to be able to bring plans like this in place to do comprehensive diagnostics and help patients take this care into their own hands.
Well, sounds great. Jimmy, thank you so much for all of this helpful information.
Wonderful. Thank you for having me, and thanks for the chance to share.
Of course. To learn more, go to agentislongevity.com.